Good afternoon. Thanks for tuning in today to our Connected Healthcare Community monthly meeting. I'm really excited today to talk about how dentists help healthcare get better. Before we get started, really to dive in here, I'm just going to put up a quick poll question. You can select one of these answers, and the results are best practice and also critical. So a pretty good sense for today as we're talking about connected care and team-based care. So I'm just going to intro things a little bit, talking about the many roles dentists play. Interesting to kind of note that a lot of people will think about dental care as I just need to get my teeth cleaned and avoid cavities, but there are real implications across the whole spectrum of patient health that can be addressed by dentistry. So overall health, poor hygiene is bad for lots of things, conditions throughout the body, as well as an early indicator of some things that might be going wrong. Through x-rays, my dentist at one point noticed some things going on in my neck that they thought might need to be addressed by my physician, so did some referral back and forth with that stuff and went through some stuff there, and it was actually turned out to be okay, so that was good. Chronic disease management, also oral health maintenance is really important for lots of conditions, diabetes being one obvious one, and lots of others. And then pain management in terms of quality of life, it's really hard for anyone to focus on getting better or sleeping right or eating right if they've got pain. So addressing that is really important for overall health, and as well as mental health. One, I mean, not just the pain management part of that, but also poor hygiene is linked to mental health conditions such as depression, anxiety, eating disorders, things like that kind of go back into that early detection. So if we're looking at that whole picture of patient health, each touch point across the team is very important. So it's great to be able to have open communication with a patient's care team so that we can really support full health. So with that little introduction, I'm going to talk about Sandi really quick. So Sandi, thank you so much for joining us today. Sandi is the CEO of the Alberta Dental Association. She is a physical therapist by training, retired though, she wants to make clear. So she's focused on really using her certified health executive and leadership training. Sandi has a really interesting career across healthcare in lots of different ways, from lots of different perspectives. She is currently, as well as being CEO of the ADA, sits on the board of the Madian Citizens Network, which is a patient advocacy group in Alberta that does a lot of really good work around helping patients understand their role and how to access care, but also supporting the needs of patients across healthcare. She's an adjunct professor at the University of Alberta. She has worked at PwC in Health and Human Services, as well as the Health Quality Council of Alberta Board, the Mental Health Commission of Canada, so good tie-ins back to the mental health aspect of dental care, as well as the Canadian Patient Safety Institute. So really interesting perspective, Sandi, and I'm excited to hear your presentation today.
Thanks, Jeff, for the great introduction. Obviously, you've said a lot about what I can share with you in terms of the importance of oral health care in terms of your general health, but pretty much everybody has a dentist, and that's really important component to think about that, because dentists really do play an important part in your role and part of your primary healthcare team. We value a good relationship with our dentist. A lot of us are fearful of dentists. And so really recognizing how dentists are primary healthcare providers, part of a very compassionate oral healthcare team. Hygienists are really an important part of how we feel about our dentists. If we have a good relationship with our hygienist, then we usually feel valued and affiliated with our dentist as well. They're doctors first and foremost, but I just wanted to walk us through a little bit about how they're so important and part of our general community and community healthcare. So a vision of the Alberta Dental Association is pretty simple. Our role is to help support our almost 3,000 dentists, whether they're students or retirees or practicing dentists throughout their career, in terms of optimizing their physical, their mental health, and their financial health, so that they can optimize and provide high quality healthcare services to all Albertans across the province. And as I mentioned, we have about 3,000 members. The Alberta Dental Association was formed as a result of the divestment of the former Alberta Dental Association in College. We were together up until last year when the Health Professions Amendment Act, or Bill 46 as we know it, was enacted, and that did require the divestment. So since that time, Alberta dentists have had a sole designated voice for the profession and an association that's solely dedicated to serving their interests and their needs. And that's been since April 2023 when I took the helm of the association. In terms of improving oral health care, our strategy is quite simple. We have 4 essential pillars as an association supporting our members. We educate and empower dentists, dental teams, as well as patients and the public in terms of optimizing oral health care. We are an advocacy engine as well. We maintain very strong relationships with the regulator, as well as with government and insurers in terms of some of the needs of Alberta patients and optimizing oral health care and ensuring that dentists are adequately prepared to provide those services. We do have an important role in education as well for the public. When you think about dentists, a lot of your dental care is not just reactive when you need something, when you have a tooth that hurts, or if you have mouth pain or facial pain, like Jeff mentioned he did. It's also about prevention. And so they do play a very important role in primary prevention because your mouth is the gateway to the rest of your body. And we also celebrate our people. Dentists are they're part of the fabric of our communities. And yes, you might feel that when you drive around your respective community, you might see a lot of dental practices. Those are mini hospitals that are operating in, whether it is a strip mall or if it is in a professional building. They're entrepreneurs. They're bringing access to oral health care to communities that need them. And they are really invested in their communities as business owners. Many of them are small business owners, and they are really essential fabric of our communities, but also of our healthcare teams, as I mentioned. The Alberta Dental Association, of course, is led by dentists for dentists. So we do have a 9-member board of directors, all are practicing dentists. And it's very important that we have very diverse perspectives. Some of them are small practice owners, they're associates in the practice throughout their careers, different ages and stages of their career, and also practice in different geographies of the province. So they are elected by their fellow dentists, representing 5 different electoral districts across the province. And our staff team, we're a small but mighty team. We have one individual who's missing from this slide, but over the past year and a half, since the new Alberta Dental Association has been up and running, we've grown our staff team to really provide services and advance on our strategy for our members. So we have folks that answer the many phone calls, both from our members and from dental practices. So when they have questions about insurance or questions about different things that might be covered or programs, as well as we answer a lot of questions from members of the public too, in terms of how to find a dentist in their community, how to find a dentist that might speak their language that they might prefer within their cultural community, and also questions just about how dental fees work and how dental insurance works within their coverage, whether it's an employer-sponsored plan or if they have access to a government plan. This really sums it up, dentistry in a nutshell. Dentists are really important advocates for improving oral health care as a part of general health. And of course, we are collaborators with other health system partners. As I mentioned before, the mouth is very much the gateway to the body in terms of when we see people, when we interact with people. Our face and our facial features and how we communicate and how we appear in terms of our face and our mouth is a really important part of our quality of life. It's how we're perceived, it's how we communicate, it's how we express ourselves to the outside world. And dentists take care of all of those aspects. So when you think not just about your oral health care and your teeth, they're actually involved in the face and all of our quality that we obtain through eating, through nutrition, through communication. It's well established that there's many links between oral health and systemic diseases. When you think about cardiovascular diseases, our health of our gum and our tissues in our mouth actually have big impact on our cardiovascular health. There is very strong links. As I mentioned, quality of life and how we're perceived with our mouth. If we have tooth pain, like Jeff mentioned before, it impacts how you feel about yourself and your mental health and well-being. But also how our teeth appear. It also impacts how we might be feeling on our own self-confidence and self-worth. And as I mentioned before, dentists very much are the front line of prevention. So preventing other oral or systemic diseases is really important. Again, that your mouth is your gateway to your body. Very important for disease prevention. Oral healthcare screening is also something that can help identify early indicators of other chronic conditions. And for some people that live with chronic conditions like autoimmune diseases or diabetes, having really good oral health care is so important to maintaining overall health and maintaining your disease. So what is dentistry? Most people think of their general dentist or their family dentist. Again, I mentioned it's about not just about your teeth, it's also your entire mouth, your mouth cavity, as well as your gum tissue and other oral health or oral tissues. It's also about your jaw and your joints. So when you think about everything that's your head up around your jaw and around how you function, and again, adjacent structures, the head and neck. Jeff mentioned a great example. He was having some neck pain and his dentist determined it was something that might need to be referred on to whether it's a physician or even a physiotherapist. So very integral to collaborating and coordinating with other health professions, all to maintain the physical, psychological, and social health of everybody in Alberta. When you think of dentists, you might think about, or you might have had the opportunity to be referred to a dental specialist, and there are several. Dental public health, pediatric dentistry, orthodontics. So when you think about orthodontics, this is actually orthopedic specialists that specialize in the mouth and how our jaws and our teeth work. It is actually a form of orthopedics. Periodontics, that's actually a specialty that focuses on the gum tissue around your teeth. So really important in terms of health prevention. And again, really important for people with chronic disease conditions. Endodontics also focuses on the tissues, but this actually focuses on the roots of your teeth. So when you think about the pulp that actually goes into the root of your tooth, endodontics play a very important surgical role in optimizing the health of your root cavities. Also, when you think about prosthodontics, so prosthodontics is actually, these are the really interesting specialists that do a lot of reconstructive surgery. So when you think about traumas or other disease conditions that might cause disfigurement, so when you think about implants or surgeries that actually do a lot of facial reconstruction, really important specialists that provide that service for people. Oral medicine and pathology, oral maxillofacial surgeons are not just the folks that take out wisdom teeth. They also treat a lot of oral conditions, provide specialist surgical procedures. They collaborate with other surgeons and other specialists like ENT providers in the medical field, also speech language pathologists and others to really optimize the function of your mouth. And so I mentioned surgery already, and also radiology. This is a very small and specialized radiological field in terms of dentistry and oral and maxillofacial aspects of your head and neck. So all these specialists are actually dentists. They're medical doctors that have a specialized focus in general dentistry or one of these specialty fields through advanced education. And they're all members of the association as well. Really well said in terms of members of your care team. All of us on this line today are really invested in optimizing connected and community healthcare and integrated healthcare services. So dentists, as I mentioned, are collaborators. They are specialists in their field. They refer to others and people can refer to them as well. And they provide a fresh perspective in terms of health promotion and prevention. In terms of services for patients, so if you are looking for resources to refer patients or patients or community members or community groups to, the Alberta Dental Association, we have a lot of great information on our website that is geared towards public and members of the public and patients looking for resources. Community dental clinics, I mentioned that there is some public health dentistry. The U of A we're very fortunate that we have a university that provides such high quality dental training, trains members of the dental team, but also has an amazing cohort of dentist students that come out every year. There's also a lot of community clinics that are focused on low or marginalized populations. So Radius Health in Edmonton, we have Alex Clinics in Calgary that provide services for people that may not have access to dental care or might not have access to optimized rural health care. One thing that you might have heard about in the news, or you might have seen recent advertisements, is the federal government's initiative to provide more access to people without dental benefits or without dental insurance through the Canadian Dental Care Plan. This is a new government-run program which essentially provides a subsidy to any families that have a combined family income of less than $90,000, and that's on a prorated basis depending on your combined family income. Individuals that are under that income threshold, the Canadian government will let them know that they are eligible to apply, and if they apply to receive care under the dental care plan, they can access any dentist that is providing services under that insurance plan. And this has been a very landmark time for Canadian dentistry in terms of providing more access to more people across the country. So really things that we've worked hard with the federal government and now of course with the provincial government in terms of improving access for oral health care is ensuring people have choice. Just like any other healthcare professional, we want to ensure that patients have access and can choose their preferred dental provider, somebody that's in their community, somebody that respects their cultural needs or even their accessibility needs. And so that's been something that we've been advocating hard for Alberta dentists, but also for Albertans. Part of improving access is ensuring that pre-approvals that sometimes insurance companies will put forward, that those are expedited so that somebody's not having to take more time off work or more time off school or even going back for repeat visits. So when some of these government programs like the Canadian Dental Care Plan were first launched, we worked hard with the federal government to make sure that some of those procedures and administrative processes that we know we all have to do in different office environments were expedited so that it didn't provide a barrier to accessing care. And the other thing too, that with this new Canadian Dental Care Plan, let's face it, dentistry is a private part of our healthcare system, and it has run well with access to third-party benefits, whether it's employer-sponsored benefits, if it's government-provided benefits, school benefits that provide access to dental coverage. Unfortunately, what this means with the government now chipping in and providing subsidy for some Canadians is that some employers might look at dropping their dental coverage. And for the most part, a lot of the employer-sponsored dental benefits are much better than what the government programs offer. And so this is something that we're continuing to advocate for, is that insurance companies not dropping dental benefits right now because a lot of them provide much more comprehensive care than a government-sponsored program could. And some people, particularly those on social programs in Alberta, there are government-sponsored programs, and with the federal government's introduction of a new dental benefit, we want to make sure that it coordinates together with the provincial programs. In Alberta here, with some of the changes and the political pressure around federalism, our Premier has decided to opt out of the Canadian Dental Care Plan and to continue to provide access to dental benefits for low-income Albertans through our social programs. That is something that we have very significant concerns about the sustainability of those programs, and we are continuing to work hard on advocating for more comprehensive coverage and more access for Albertans, but also sustainable programs for dental practices as well. So there are several. I mentioned the social programs, the child health benefit, the income support programs. There's the dental assistance for seniors program, and of course providing services through AISH, as well as from the public health and dental treatment services. So those services are programs that we continue to offer through a variety of dental offices across the province. And as I mentioned, we do have lots of great resources on our website. I'll point out a few more in terms of other resources. So we do have patient-related resources for general health, even overcoming things about fear of dentistry, overcoming dental anxiety. It's a very well-researched subject. A lot of our members actually focus really heavily on improving people's experience of care in terms of reducing anxiety. Information about where to access healthcare, help for low-income Albertans. So I've identified some of those social programs, a guide for understanding dental fees because it's confusing. Not every insurance program is the same. Some insurance programs compare or cover different things, or some insurers will provide different levels of coverage for different fees. And so we want to make sure people actually understand their dental fees before they go in to see their dentist. And of course, general dentistry, questions and answers about dentistry. And we're always just a phone call or an email away, and happy to support any questions from our other healthcare team members as well as from members of the public. Couple of things coming soon. We are going to be launching our Alberta Find a Dentist website. So people that are looking for a dentist will have a searchable interactive map around things like, can I find somebody who is accepting new patients? Do they accept children? Do they have a wheelchair accessibility lift? Any things like that. So that'll be launching very soon on our public website. And then every year in Canada is Oral Health Month. So we are going to be working with partners to be providing some more patient and public-oriented resources to celebrate Oral Health Month. And we work together with lots of clinics and with insurers across the province to really celebrate Oral Health Month and bring more resources. So that is in April of next year, so stay tuned for that. And of course, we are active on our social media channels and providing more information out for more public-oriented audiences. So please do engage with us on our different social media platforms, or reach out to our contact information listed here on the screen. And with that, I will turn it back to Jeff for any time for questions.
Great. Hey, thank you so much for that. That's a really good synopsis and presentation about dentistry as a whole and what's happening in the field. Some really important issues going on, obviously, right now that really impact the team and raise interest in dentistry. I think a lot we should be paying attention to that. So I am going to launch our last poll question here. We just want to know about how you communicate with your patient's healthcare team. Is it difficult? Is it something you do, something you don't do? And then we'll look at the results here. So mostly going through Brightsquid, so that makes sense. We're talking to primarily Brightsquid users in this group, and also a little bit of none of the above. We will go through here to questions. Have the dentists been contacted to give their information about accessibility, et cetera, in their office? This was part of your Find a Dentist that was coming soon. So how does that going to work?
Yeah, you bet. As part of our member registration process, they list languages spoken, any accessibility requirements or that they actually offer to their patients. So that will actually be displayed as fields in our Find a Dentist website when that's launched. Right now, if you are looking for that information, you could certainly let us know, and we do have access to that through the back end. But we are going to be launching that in November of next year, or this year, pardon me, it's next month.
Another question is, what duty do dentists have to report conditions that they detect? So like in my case, whatever's going on in my neck, or is there anything around that, and how would that happen?
So of course, as healthcare professionals, so they are regulated by the College of Dental Surgeons of Alberta, and they hold their standards of practice. And referral to other healthcare providers is an important part of care, whether that's other oral healthcare team members, other dental specialists. So of course, they can only operate within their standards and within their scope of practice. And then of course, there's a lot of referrals. So I mentioned, things like physio, speech and language pathology, and of course to other medical specialists as well. I didn't provide some of the data or statistics, but dentists are a really important part of emergency department avoidance. When I was actually meeting with the chief dental officer of public health this week, and there's over 20,000 visits to emergency departments that are dental related. Some of them are due to trauma, which is of course, obviously somebody gets hit in the face or whatnot and they have some dental trauma. But a lot of those are things that could actually be treated by dentists in the community. And a dentist, if there's head and neck pain or tooth pain, the dentist can assess that and provide emergency care. And then if it does require referral, they can usually expedite referrals to other specialists as well.
Very cool. How can clinics best identify dentists to work with? So you talk about Find a Dentist, so that would be patient focused. If a clinic has a question related to the care of a patient, is there a repository where they could access some dental expertise or identify sort of the best course in that case?
You know, interestingly, I mentioned at the front end of the presentation, like how many people have a dentist, and most people have a regular dentist that they go to see. I know, like I've been seeing the same dentist for the majority of my life, like since I've had teeth as an adult, and that's really important because it's about continuity of care. And so when somebody's looking or needing some information about dental or to refer, usually asking your patient if they actually have a regular dentist, and that would be a way to communicate with them. There is opportunities, obviously, to communicate and collaborate through technology tools, and you know, Brightsquid is a member benefit that we now are delighted to provide to our members as well. But dentists are the fabric of the community, and there's a lot of dental clinics that would be willing to, you know, look at some opportunity for collaboration with other health providers in terms of referral or advice. But if it is just general dental advice, then we do have a dental consultant on staff. So Dr. Tony Odenbaugh is available to answer any questions that people might have or to provide any referral information as well.
Great. Yeah, Dr. Odenbaugh's very, very approachable and knowledgeable guy. So that's good. I guess a follow-up to that is it best to start with a general dentist, so the patient's general dentist they see, and allow that dentist to make the assessment for any kind of specialization that would be needed?
Yes, absolutely. Absolutely. People can self-refer to some of the dental specialists, but it is always best to actually see a general dentist to determine that right referral source.
Is there a focus on the ADA website with the new dental technologies? So explaining some of that stuff. And one example here is the dental pain eraser. So painless local anesthesia, administering things like that. Are there tools like that available to understand those things, I guess?
Yeah, you know, we don't actually promote specific products or technologies. There's a lot of innovation that's happening right now in terms of automated intelligence, but also other dental technologies. We try to make sure people have information and education about what that actually means. So how can patients know, you know, in terms of what their optimized care is, but also how they can feel empowered to ask questions about their dentist or with their dentist and dental team about the technologies that are being used. So we want to make sure that they uphold the right standards of practice, that they're regulated tools and equipment, but that's outside of the association's role for sure.
From a type of technology standpoint, I know you've got, you know, trainers on staff looking at, you know, how to help dentists understand all of these fast-paced changes, and we work with clinics on a regular basis to help understand how technology might impact privacy compliance in their clinic, or ways to look at evaluating those things. So there's always questions about that stuff, and it is always changing quite rapidly. So it's good to keep on top of it, and the association, I know, plays a big role in helping people understand what the options are. So Sandi, thank you so much for your time today. Really appreciate it. Very insightful presentation. And any final words before we sign off here?
No, feel free to visit our website, and if you have any questions, feel free to reach out to us and our staff team, and we're more than happy to continue the collaboration as part of the connected healthcare community.
Thank you again, Sandi, so much, and thanks everybody for tuning in. Have a great day.